Hi everyone. So I just want to share my day, as today it was my first day volunteering as a nurse assistant um, in a hospital, and it was a 4-hour shift, and it was very eye-opening. And I'm just gonna tell everybody because people might wonder, oh, why am I volunteering? Um, First and foremost, because some people are actually know about my health condition. I have ALS, but at the same time, there is a need of help in the medical health line facilities out there. And I started thinking about this for the past a month and a half. I'm not a certified nurse because I only finished 3 years of Bachelor of Science in Nursing. And if I had stopped on that 3rd year and wanted to practice the profession, I would have been an RPN instead of an RN. But enough of that. The chief volunteer knows about my health situation, and they know not to put me in high risk areas because number one, I have diabetes. Number two, I was a colon cancer survivor. And number three, I have ALS. So for me to be in an area where the frontline workers are, it would have been hard. The first thing I've requested before was actually if I could be in the telehealth call center and just answer calls, because I'm knowledgeable about medical conditions. But because I'm not a certified nurse, I couldn't do that. But they've assigned me actually in the assisting part of the nurse, where I was packing surgical gloves and 95 masks for the ongoing and next going shifts of the nurses and doctors. And also I was also organizing with different sanitized products such as alcohol sanitizing sprays and stuff like that. But the first part was I was actually assigned in the admittance area, and I was just interviewing people who needed to go on a non-emergency situation, and had no choice but to go to the hospital to be looked at. So I did that. I was very protected, just to let you know. I had mask, and if you see, I have I don't know if you call that a scarf, but like I was wearing mask the whole time, and goggles and gloves. So it's an eye-opener for me because I've seen the area, I've seen the hospital, and thank God I was not assigned in the frontline area because I don't know if I would be able to handle it. And being there myself, I started becoming emotional. And I started thinking about my sister, who's a nurse, Cynthia, and my nephew RJ, and my two of my siblings who are two of my nieces. My niece and my nephew are doctors, and my sister is a doctor, and my other sister who's working for her in the hospital, in the clinic. it's a very sad environment, because even that I was not in the frontline area, you would know. And if there was, like, when a very important COVID patient comes in, because it's like fast paced, and just seeing one person there and without having his or her family there, and that person is like struggling, it's hard, because I don't want any even of my family or people that I care about would be able to face that situation. I'm like, my mom, when she died, at least all of my siblings with her, but this is a different story. And I just want to know, because some people are making negative comments about me volunteering. It's not a paid position, although they cover your transportation cost. So I Ubered going back. And they need help. So I encourage everybody, a lot of people in the pageant industry who are directors were former nurses. So Tito Edgar Sulit, Tito Lito Legasca, these are retired nurses, and other nurses, retired nurses or non-practicing nurse or retired doctors. Please, if you can spare your time to help and assist in the medical field, they need the help. They need the help, and they need a lot of people. I was asked actually if I wanted to volunteer in nursing home, but because of my health condition, it will be of a high risk for me. But I can say today was a very eye-opening experience for me, and there was no regret of me giving my time there. It's so hard to explain how I feel right now, but I salute everybody who's actually there battling in the frontline position in the medical field, in the hospital. And I wish I could do more, but because of my health condition, I feel so limited. But for people who have retired or people who can be there on the front lines, I really suggest that you donate your time, even once a week, twice a week. It's gonna make a difference. And for people who don't go out if you don't have to, don't go out there if you don't have to, because you don't know, you might not be showing symptoms, and you might not be giving out diseases, or you might not have a disease or not showing the symptoms, but you could be a carrier. So please, that's all I have to say. And let's continue praying for our frontline people, because they're doing an amazing job. And thank you again for the kind words. Bye.